I would like to thank you for attending, for joining us, and be very welcome to this webinar. This webinar is organized by the Education and Research Working Group of the Europe region of World Physiotherapy, and is titled, How Does Research Advance Physiotherapy in Europe? As we all know, there has been a significant growth of rehabilitation research in the past 20 years. Physiotherapists must stay abreast of research to enhance their decision-making and use evidence-based physiotherapy. This involves being knowledgeable about latest research and enhancing and engaging with the research community. This webinar will be focused on the importance of research for the physiotherapy profession. There will be 6 presentations about the importance of research for the physiotherapy profession, as I mentioned. One of them will be focused on a survey developed and analyzed by the Education and Research Working Group about research awareness. We also have 3 good examples of research, and also an experience from one member organization on developing a research network will be presented. Let's start with the first panelist, Professor Nikolaos Strimpakos. His presentation is about research awareness in the Europe region, a survey of member organizations. Professor Nikolaos Strimpakos is a member of the Education and Research Working Group. He is professor of the Department of Physiotherapy at the University of Thessaly in Greece. The floor is yours, Professor Strimpakos.
Ladies and gentlemen, good afternoon. Thank you very much for joining us today in this webinar. I will present you the results of a survey on research awareness in member organizations. We conducted this survey during our term 2020 to 2022 as Education Matter Working Group. You can see now the members of these members. So the main objective of our survey was to collect information from member organizations regarding research interests, attitudes, perceptions, and the awareness of national associations. And also, we would like to explore the needs of support for being involved or facilitating research efforts of national associations. For this reason, we made an online questionnaire in 2021. We sent this questionnaire to 37 member organizations of the European region. And we had a very high response rate, more than 80%. 31 countries were responding. So the main question, the first question we asked the member associations was if they believe that the research is very important for our profession, for physiotherapy profession. As we expect, more than 90% of the members reacted that research is very, very important. We asked them also if they have any policies about research in their country, in their association. And here we can see that most of them, more than half of them, they said that they don't have any specific research policies. Some countries, they said that they had the research policies in their constitutions, or they plan research strategies, or they follow research strategies from specific universities. And some other replied that they follow policies from the research of Ministry of Health or Ministry of Education, or they follow ethical principles or specific scientific acts in their country. We asked them also if they have any specific research network or network groups in their country, Again, more than 60% of the countries, they said they don't have any research network. Some of them, they have research societies or research communities or a research network, but these are a minority. We asked the member organizations if they have any budget, if they have any money, any funds in their budget for research, or if they have any support for research in their budget. Again, the minority, they said yes, and most of them, they have support from a government or ministries, and also from national or European funds. Some of them, they have funds from private companies or the association gives some money for research, and some of them, they have support from individuals. Another question was if the member organization involved or participate in any research study as coordinator or as partner. Again, most of them, they don't participate in any research project. And the reasons for this one is mainly financial problems, and also interesting thing is that they have lack of interest. We have also some other answers like the lack of knowledge or lack of time for running any research project. However, most of the countries reply that 90% of them encourage their members to engage in research. And they do that through courses or financial support or webinars like today. And also they use expertise support or fundraising. In any case, less than 20% of the members are conducting or involving in research. Less than 20% of physiotherapy in its country. More specifically, we ask the member organizations if they run any congress or any platform for their members in order to present their research results. Some countries, they run annual congresses or every 2-year congresses. But we have also some countries, especially the small countries, they don't run any congress because of little of financial reasons, of course, and also little interest or not enough studies and speakers. Regarding the research needs, we ask the members if they need any help for their for promoting research or for facilitating research among their members. More than 70% asked for help from a European region. Again, the help they need concerns the financial support and expertise also. And more than half of the members, they ask webinars or courses or help for networking or help with discussing with the authorities for finding money for research and so on. But in each case, they said that the barriers for engaging members of research are quite a few. Most of them concern the lack of motivation for research or the lack of ability or knowledge to plan a study. We have also difficulties for access to resources like labs, equipment, facilities, lack of networking, and these factors will be the main barriers for engaging members in research. For this reason, we asked them what they recommend in order to facilitate research among their members, and most of them, except the financial resources and the fundraising, talk about academic support, research support. They think that establishing awards in congresses will be useful. The webinar or courses regarding the research and how you conduct the research, or establishing a research question, will be very useful. And for this reason, we did that today. So after the survey, we made some recommendations as working group to two levels, in a European region level and in association level. For European region, we believe that the European region have to emphasize for the importance of research and to talk with that for that with the member organization. Have to facilitate member organization to participate and raise research activities within the association and on a member basis, and also have to help the member organization for organizing webinars, courses, and seminars related to research. On association level, we recommend that the association have to facilitate and promote the physiotherapy in their country to undertake research activities. Have to promote research awareness by organizing congresses, courses, and webinars, usually in collaboration with universities, because they have the know-how about research, and they have facilities also and equipment. It's very useful to establish in each country a research group or research network, and also the member organizations have to support the academic financially in collaboration with academia and the other stakeholders like industrial sector companies, the physiotherapy want to undertake or to involve in any research activity. Thank you very much for your attention.
Thank you very much, Nikolaos. We continue with the second presentation. In this case, Dr. Sheill will be the panelist, keynote speaker. She is a member of the Education and Research Working Group. She currently works at the Department of Physiotherapy in Trinity College and at the Department of Physiotherapy in St. James Hospital in Dublin. And her presentation is entitled The Importance of Research for the Physiotherapy Profession.
Thanks, Carmen, for the introduction. I'm really happy to be here to talk on this topic tonight. For the next 10 minutes, I just want to take a look at research and research value, and really look at maybe some trends in research in physiotherapy and how we can increase the impact of physiotherapy research globally. So I just want to start by talking broadly about research, and the definition of research, I guess, will be familiar to a lot of people. We look specifically at, health research or medical research, and there's really such diversity now in what research means. We maybe traditionally would have thought of clinical trials and clinical studies, but now we have to take a much broader view and think about cohort studies, case studies, and some of the other studies that we've mentioned here. So as well as physiotherapists having a really important place in health services research and epidemiological studies with data, etc., now we're also really looking at, well, what are the factors that influence health? And there's physiotherapy studies now looking at social factors that impact on people's health, behavioral factors, economic factors that impact on people's health. So it's really such a broad area. And I guess there's so much scope for us to be involved in this type of research. So then thinking about what is the value then that this research brings? Well, this is such a long list and so diverse, but really the Institute of Medicine came out with this report, and it's from 2009, but really it was a very detailed report looking at how we can improve health through research. And they just outlined some of these benefits. So we can look at disease trends and risk factors to almost try and get ahead of some of the health issues that affect populations. We can really examine the outcomes of treatment and in public health interventions. And really, we're talking here about really high quality, cost effective care. And that's where research is going to point us in the direction of. We can look at functional abilities, and for our area, I guess, look at where are those functional abilities lower and where should we direct our interventions, patterns of care. And increasingly, we're really asked to make the case for a lot of our interventions based on cost benefit, based on maybe cost utility analysis or broader healthcare costs and use. So we really need to look at, okay, that's the value in research, and our physios really participating in that research because we know that the potential benefits on human health can increase productivity of population and contribute greatly to a national economy. So we've got this small scale, and also we have this larger scale in terms of national and global pictures. And now we have to look at not only clinical trials, but we have to marry that with clinical experience. And this is where a lot of qualitative work is coming in now, getting patients' views, getting clinicians' views, and really marrying this kind of information together. And of course, with evidence-based practice, we have to put that then with patient values. And again, we need research in that area. For evidence-based practice, we should be kind of having great knowledge in all those three areas together. So that's the Institute of Health of Medicine's take. So just for a second, looking at trends in physiotherapy research. So this was published in 2019, and it looked back on physiotherapy research over the previous kind of years. And it looks at, well, what is the kind of trend in research? So in all human-based health research, we have improved from 0.5% to 2.5% of research. So exponential increase when you think of the amount of papers that are published now, exponential increase in physiotherapy-based research indexed with physical therapists on PubMed. Then we look at as a percentage of health research. So we have improved from 38% right up to 58% of health research. So there is such improvements in this area. They commented that RCTs, randomized controlled trials, were increasing year on year by 6%, and an even larger increase for systematic reviews. That year on year, we are producing more research and reviews in that and publishing them in these indexed journals. If we look at age groups, so over the course of this study, over that 20 years, there was a significant decrease in the amount of studies looking at pediatric populations. And again, we need to look at that now. What are the trends in that population that maybe physio need to look at? But there was no change in terms of our research in adults and older adults. And then just, I guess, finally looking at what are the areas that we're doing research in. This is really important. These are areas that we really now have evidence that we need to contribute to patient care, and we are doing that in a lot of areas. And how do we continue that? Well, the top two are the nervous system and MSK, musculoskeletal conditions. They were the most commonly researched. Then we had a decline, I suppose, over the course of this study in cardiovascular and pulmonary research. And we had an exponential increase in neoplasm and in cancer research, which has really taken off during this period. So we have a wide range of research in these areas, and it's really important. And they put it down to these trends. And really, if we talk about the importance of research and building it going forward, we need to continue to build on these trends. So one is increased awareness, and initiatives like this tonight and a lot of member organizations coming out with guidance in this area will increase awareness of the need to advance the physiotherapy evidence base. There's now a lot of physiotherapists with graduate degrees that have a lot of research skills, and we need to really harness that. And we also have a lot of research embedded in our undergraduate programs. And we now, again, are seeing the benefits of that in terms of the research that's coming out and being published. We also, I guess, see that, say, nursing was included in PubMed as a mesh term in the 1960s. Physical therapists was added in 2012. So they also feel that that's greatly increased the number of papers that we can find now that are specific to physical rehabilitation and physical health. So I really just wanted to talk about impact and give one case study on the impact of research. And this is a busy slide, but it just emphasizes that we need to look at impact in the long term. So in the short term, yes, we get our publications, but in the long term, the potential for impact is huge. We can see here there's policy making. We know now once you have a study, then we have something to talk about. We can meet with policymakers. We can actually contribute to the information base that policies are made from. And then when we go further, we have evidence-based practice and filling unmet clinical needs, for example, looking at the quality of the care that we contribute, looking at cost savings, resource allocation. It's very important. So if we're looking at health impact, we want to make sure that patients get maximal benefit and that we minimize research waste. And that's really what's happening now. And I just wanted to give one example of that. So this is the UK's Research Excellence Framework. So they ask HEIs, so universities, to demonstrate the impact of some of their research. And this is published, I've just taken one example. So this is Jackie Morris's work, she's in Dundee, and they got about £300,000 worth of research to look at stroke outcomes. And she focused on 3 areas. Those 3 areas really aren't important. But when they wrote up the impact of their research, this is what they were able to say. So physiotherapy research focusing on rehabilitation after stroke. Their research then informed the Canadian stroke best practice guidelines. It highlighted in the stroke handbook the role of physiotherapy for stroke rehabilitation, and that's used by 50,000 to I suppose assess 50,000 stroke survivors. They were able to quantify the amount of people that were affected by this. Their studies, they had 6 publications, they had 2 Cochrane reviews and some systematic reviews. And then they were able to say, well, their reviews were included on the Dutch physiotherapy guidelines. The Australian government cited some of their reviews when they were looking at what quality indicators they should have post-stroke in terms of how quick patients should receive rehabilitation after stroke. And the American Heart Association also consulted them and cited them when they were creating their strategic policy statement. And this is published, you can look at this online, but it's very convincing in terms of, okay, the international impact of this funding given to these researchers was very wide. And we know that the research area, health research in the UK is worth about £2 billion every year. So what we need to start doing now is showing the impact that that research can have. And then that research influenced policy and ultimately led to a change in rehabilitation service delivery for patients with stroke. They looked at local need as well. So that was very international, but they saw a change in the amount of stroke rehabilitation that patients in their area, their hospital, their area received. And they also did a lot of work on physical activity after stroke. And they had local health commissioners then bought into the idea that they actually needed more services for patients to be physically active after stroke. And they showed that those services then improved. So really close look at impact. So if we're going to, I suppose, do this in the area of physiotherapy, then we need to support therapists, I guess, to come out with this evidence and then support them to really kind of, I suppose, work with a lot of the findings of their research to make sure that they do reach impact on a national and international level. So to encourage physios to continue to be involved in research or to start being involved with research, these papers from Sweden looked at what is needed. And there's things needed on an individual level. We have to make sure that patients have, or that physiotherapists have a good attitude and are motivated to engage in research. From a workplace level. Actually, one of the strongest needs was leadership support, so management support for patients to take on research. They need resources, they need to find out information, and outside of their organization, they need the environment of support of conferences and so on, to be able to, I guess, navigate developing a research question and then developing, I suppose, proposals and the paperwork needed, I guess, to get research off the ground. So really insightful and gives us an idea of, I guess, how we can encourage research going forward. So from this talk, I guess we've just highlighted that there is now an increasing level of physiotherapy research out there. We know, though, that physiotherapy is constantly evolving. Our areas of practice are constantly changing, and there's new areas that need further research. And the CSP's document I've just referenced is here that identified 10 areas that needed research input, but I suppose there's an equivalent document in a lot of specific areas of practice and so on. So we really need to make sure that physios are continue to be trained in this area, and then not also trained, but when they start working clinically, that research continues even in the clinical environment. So that's the kind of nurturing the research requirements of physiotherapists. And then broadly, I guess we need that further collaboration. We need closer bonds between academic institutions and clinical sites to make sure that really relevant research questions are asked, and then we're able to answer those research questions with populations that are, accessible through the clinical sites, and that we're really, I guess, jointly asking and answering those research questions. And that collaboration really is key. So that's my contribution tonight. Thank you for your time, and I'm very happy to take any questions at the end.
Thank you very much, Gronia. We will continue with the 3 good examples of research. The first example is going to be presented by Professor Ralf Meesen. The presentation is titled From Research to Therapy, Accelerating Research Implementations in Belgium's Clinical Practice. Professor Ralf Meesen is a member of the Education and Research Working Group, and he is full professor and dean of the Faculty of Rehabilitation Science at Hasselt University in Belgium.
It may be a somewhat strange title for you, and you may wonder what they are doing now in Belgium. But I think it's a nice example of best practices, and it perfectly reflects the efforts our professional organization makes for its member to make research accessible. Everything presented today on the point of care sources, the examples given, is freely accessible for the members of Axon or professional organization. So what's the easiest way to bring evidence-based practice into your clinical practice? How would evidence-based practice be applied in an ideal situation? It's based on 3 pillars. This involves a proportional use of clinical expertise, patient values, as well as the best scientific evidence. But we often see in practice that there is no proportionate use of those 3 components. Many physiotherapists primarily use their clinical expertise and patient values because the best evidence is often difficult to access. It's hard to get the best scientific evidence. It's also very time-consuming to check the evidence for its clinical usefulness, and there are several other reasons why they don't use this best scientific evidence in their clinical reasoning. Looking up good, reliable sources is not so obvious. We live in the 21st century in an information jungle where we often can't see the wood for the trees. Where to start looking? Is the source reliable? Is it the most recent resource? Sometimes you can find a good article on the internet, but it charges 30 or 80 euros to download it. But then you're still not sure whether or not it is relevant for your practice. This is a nice review of Paki, and he unveiled the most important barriers to evidence-based practice implementations. And the main obstacles here are accessibility. A physiotherapist in the field, they have often less or no access, which is in contrast with their student time, where they had easy access through the university library. And another main barrier is the time. It's very time-consuming to validate this evidence. And the third obstacle which they identified is the language barrier. So if the the evidence is not in the mother tongue, you see really a reduction of the use of it. But we have good news. The two main barriers can be tackled by point-of-care sources, namely the time-consuming aspect and the accessibility. Point-of-care sources, these resources are specially designed to support clinical decision-making. They include tools and summaries that help clinicians apply for information to patient care quickly and effectively, providing immediately validated evidence-based guidance directly at the bedside. Accessibility, it's especially designed for a quick, easy access at the point of care. And this is crucial in busy clinical settings where time is limited. What you also have to know, it's continuously updated by specialists. Examples of point-of-care sources are Dynamed or UpToDate. These updates are integrated into their content. This ensures that healthcare professionals have access to the most current information to guide their clinical decisions. Accreditation and recognition, Dynamed and UpToDate are recognized and accredited by reputable medical organizations. Their processes for creating and reviewing content meet high standards for accuracy and reliability, making them trusted sources in the healthcare community. This is an important issue, since the reviewing of evidence like an RCT on sources like PubMed takes a considerable amount of time before they can be used in a clinical setting. They also have, it's very nice, a peer review and feedback mechanisms. Both platforms have mechanisms for peer review and allow for feedback from users. This continuous peer oversight and the ability to correct or update information based on user feedback further enhance their reliability. Before we start with an example, for clarification, let us first explain to you the levels of evidence. This is because not all types of studies have the same quality label. If you see in this pyramid, the higher you go in the pyramid, the higher the quality of evidence is. The lower we start looking in the pyramid, the quality of evidence is lower. And it's also more time-consuming. This is because the large volume you have and the process that it takes to the publications to check with checklists. So if you use the unfiltered information, this one, you have to control it with checklists. If you go on the top of the pyramid with the point-of-care sources, guidelines, systematic reviews, and analysis, it's filtered and controlled information. So higher quality, less time-consuming. If you go in this area of the pyramid, you have to fulfill checklists. Checklists like Cochrane checklist of bias tool for randomized control site, checklist for disseminated findings from intervention reviews, and so on. And it's very time-consuming. So why should you use point-of-care sources? They are validated by methodological specialists, which means that you do not have to do the validation with a checklist by yourselves. So you save a lot of time. But the proof of the pudding is in the eating. What did I do? What did I do? I put two students, and they were presented with a case. And I asked them to make time calculations for both approaches. So they got this case. The test case was a 65-year-old man, recreational athlete, and persistent Achilles tendon complaints. So far, he had a lot of NSAIDs, non-steroidal anti-inflammatory drugs. And he comes to you and he asks, can you help me? So they first started with a PubMed, which is very familiar. And they went through all the steps. So they first formulated their research question. What can I do as a physiotherapist? And what would be the best option? So shockwave, stretching, eccentric exercises, name it, they had to look for it. They first made a Pico, so it was a middle-aged male. The disease was a Sheill tendinopathy. The intervention was physiotherapy as compared to non-steroid anti-inflammatory drugs, and the outcome was pain reduction. So they selected PubMed, they chose research term, they combined Boolean operators, and so on. They included the studies based on title, abstracts, and so on. Step 4, they did a quality assessment with Cochrane checklist, with agreed tools, everything what was needed and done by the book. If they looked up all the time they used to find out what can I do with a physiotherapy and what should I do the best, you see they started with 175 research results. They used filters and so on, date of publications, and they ended up with 9 publications, and then the number included based on title abstract, so they finished with 4 publications to do the checklist. In total, it took them 5 hours and 12 minutes to figure out what they should do the best. They did the same with a point of care source, in this case, Dynamed. And once they entered Dynamed, they entered the main research time and they entered Achilles tendinopathy. And then you come up with a number of publications, like you can see here, and guidelines. Based on the title, the best strategy is to go for the most generic description. So they started with Achilles tendinopathy. Then they arrived at this screen. They clicked on management, and here they see in the management overview directly what they should do the best. So in a comparative way, a lot of physiotherapy interventions are already listed here. And you see, eccentric loading exercise program is strong recommendation. Stretching, weak recommendation. Extracorporeal shockwave therapy, if no responsive to the above therapies, they can consider this too. So they get direct access to the most meaningful interventions they should do with Achilles tendinopathy. If you use this, you can click on it and you can also go deeper on it. And you see, for example, here's a closer view, what it takes for example, for shockwave therapy, what the study summary is. If we look at the elaboration, the time to formulate a research term, picking the most appropriate publication, reading and choosing the most appropriate intervention in the management section, it took them 8 minutes. So we end up with a point of care courses, very classical sources like PubMed, from 8 minutes to 5 hours and 20 minutes. You see, this is really a huge difference. And this is exactly where these sources are made for. So they are point of care sources. You should use them immediately during your job. So I would say, don't hesitate. Go for it. Thank you.
Let's continue with the second example. The example is about Erasmus Plus project that leads it's leading by the Europe region. It's going to be presented by Michele Cannone. He's a project management professional. He works at the Fondazione Centri di Riabilitazione Padre Pio in Italy. And the presentation is UcanACT EU-funded project, research on the role of physiotherapists in oncology prevention.
Hi, everybody. Thank you for being here tonight. I will speak about this project. I will try to simplify and tell you about the project that is a huge one in 5 minutes. Basically, I will overview the project in a nutshell. The why of this project that is based on physical activity as a preventive tool for cancer is done because of the urgency. At the moment, at 2020, 4 million people are diagnosed with cancer and 1.9 million die from it. And this compared with 2018, when we submitted the proposal of the project, was 30.5 beside 4 million, and 1.3 confronted to 1.9. So number are increasing. So the first why is the urgency of doing something for preventing cancer, and physical activity could do the job. We could do the job. Beside this, we have also the positive effects of physical activity in cancer prevention, and the opportunity to raise the awareness of the key role of physiotherapists in cancer prevention. Who's the target of the project? The target of the project is 50 years old people or older living without cancer, with cancer, and also cancer survivors. So as you can see, the population was wide, and we didn't choose specific cancer patients because also on the guidelines. Who is leading the project? Mainly the work physiotherapy is coordinating the activities, but we have some wonderful partners in the consortium. I belong to the Associazione Italiana di Fisioterapia, AIFI. We have 3 universities, Seville, Madrid, and also Bologna, who is leading the technological part. And then we have the Irish Society of Chartered Physiotherapists, and one ONG organization that is established in Germany that is founded by oncology patients. What it is, the project, basically is adult and senior citizen doing cancer preventive physical activity in public urban green spaces to prevent cancer. But it's more than that, because to get to the PAGs, to the urban park with citizen, we are running screening. And basically, we're using the American College of Sports Medicine criteria for screening. And also, we are excluding patients who are not able to reach the PAGs. We are doing also a pre-evaluation, so a T1 evaluation with the help of ONCE University, with a quantitative evaluation and qualitative evaluation. And we are really analyzing tons of data. I will show you later. And we are also stratifying participants by the fitness level according to the International Physical Activity Questionnaire in its short form, the IPAC-SF. So we are stratifying in inactive people, minimally active people, and health-enhancing physical activity. As you can see in this slide, the post-evaluation, the ones that we will be doing in the T2 at the end of the project, is really huge. And we are also analyzing the point of view of professional according to the app that I will mention later, according to the quality of life, according to the fatigue, the risk fall, and so on. So tons of data are coming. Maybe in the next webinar, we will be very happy to share you the final analysis of the project research. How we are running the project, as you can see in these infographics, the project is full of deliverables. We started in 2021 with submission of the proposal, and then in 2022 we produced some research documents. As you can see on the left bottom, one need analysis made in the 3 main territories that are Bologna, that are Kilkenny, and Munich, based on interview doing with citizens of these territories. We also produced a research on benefit of PAGs, that are the public urban green spaces, and the benefit of physical activity. Then later on, we produced 2 main manuals that are intended for physiotherapists and other health professionals involved, and community manager and communicator. That is the PIM, this project, the practical intervention methodology, and the citizen engagement strategy. And also ONCE produced the evaluation methodology. Then we have also support on the technology, because the University of Bologna has produced an app that will be available on both main store for the tablet and mobile phone. And I will show you the app later on this dissertation. We have an online massive course open to physiotherapists that is based for educating physiotherapists to have high standard quality of CPPA action with citizens, and a deep communication plans with a lot of article and information articles meant to get to the citizen Then finally, we have the actions. They are running right now. Kilkenny already started 2 weeks ago. Bologna will start next Monday, and Munich is ongoing. We will have 2 sessions, one now and one in September. And then by the end of the project, tons of reports and feedback with a great lesson learned. So about the when, you know, because it's from 21 to 25, long journey, guys. About the where, I talked about the 3 main target territories, but also we have some numbers. So the participants in total, they have already been recruited. So we have these people are 270 with 50 physiotherapists engaging the CPPA action in 14 different parks of these 3 cities. So this is the main tell about the project, but I want to give you some in-depth about the main deliverable of the project. The need analysis was a great chance for us to correct and establish the decisions making on how to choose the PAGs mainly and on how to run the activities. I want to focus, for example, on the main, for example, barriers for citizens about doing CPPA in PAGs. That was pain. The 64% and half said that pain could stop them of doing physical activity, the fatigue, the health general status, the nausea, cramps, and so on. And also was important as facilitators, the accessibility to the green spaces, the presence of infrastructures like, for example, bar, place where to rest, the security of the park. So we use this data also to choose where to do our CPPA action. About the citizen engagement strategy, we use 2 big, huge documents in Europe that basically recognize the need of high levels of engagement of citizens in the decision-making process that affect citizen lives. And it was important for us to put in network, kind of focus group and WhatsApp group, the main stakeholders, the community managers, the physiotherapists, and the citizen. And when I speak of citizen, not only the citizen who are doing the activities, but also a lot of citizen association and patient associations who are cooperating with us in the project. The PIM is basically the manual for physiotherapists divided in 4 chapters. It ends with a training curriculum for them that is translated in the MOOC that I will talk you in 2 slides ahead. This is, for example, the typical session activity with a warm-up phase, specific phase, and a cool-down phase. The companion app is a guide for patients to exercise, for citizens to exercise, also for when the physiotherapist, the health professional, won't be there for them. So we have done some videos that explain the exercise and also the opportunity to re-evaluate their fitness level. As I told you, we have a T1 evaluation and T2 by the end of the project, but we were missing the middle one. So the app will do the job and will help citizens to understand if they can move to another fitness level. And also the app help to focus the attention in case of certain conditions, like, for example, diabetes, bone metastasis, frailty, urinary incontinency, and etc. And also under the exercise, we will put some tips on the specific exercise if it is good for their certain condition. The MOOC, as I told you, is the online course to provide high-quality trainings and of the professionals. So it's a huge problem. It's a huge project, and we are doing our best to go to the end with excellent results. Just some final consideration about research. I can't wait to have the data that we are collecting right now in our sessions. I think it's a great challenge to stress the importance of physio role on exercise for health and also on research in cancer field. We have the opportunity to do it better because with a European funded project, research could reach high level of quality and also we can do things the right way. And why not? Projects like this are startup for something else because by the end of everything, someone in good hands will start from where we left, and will be a great chance to keep going the great job. And that's it for tonight. Thank you for your attention.
Now it's time for the third example about interdisciplinary research that will be presented by Professor Snježana Schuster. She is Associate Professor at the University of Applied Health Science and in the Faculty of Kinesiology at the University of Zagreb. And the complete title is Interdisciplinary Research, Physiotherapy as Science Without Borders and Prejudices.
Thank you, Carmen. Hello, everyone. So I will start with the definition. Why not? The definition of interdisciplinary research in physiotherapy involves collaboration and integration of knowledge, methods, and perspectives for various disciplines, minimum 2, to address complex health problems or questions that requires diverse expertise. In interdisciplinary research, in physiotherapy, experts from different fields such as biomechanics, kinesiologists, neuroscience, psychologists, public health, and engineering, along with physiotherapists, collaborate to combine their knowledge and approaches. These diverse approaches can complement each other and enable the development of innovative solutions or discoveries that would not be possible solely within the boundaries of only one discipline. So, the aim of interdisciplinary research in physiotherapy science is to develop more comprehensive strategies for the treatment, rehabilitation, and prevention, as well as to improve the overall health status of patients. Interdisciplinary research in physiotherapy enables a holistic approach to healthcare, resulting in better outcomes for patients and society as a whole. So, the exact number of interdisciplinary research projects does not exist. Interdisciplinary research in physiotherapy is widespread and becoming increasingly important in advancing this field of science. Even though there are no exact data on the number of such projects, they can be inferred from the number of published papers. For example, PubMed records an increase in these papers over the last 20 years, although the results of such research can be tracked back to as early as the 80s. Here, you can see few examples of interdisciplinary research projects in which physiotherapists have been involved or have led initiatives and research ideas for implementation for science to clinical practice. So, the first example is a scientific research on pathological changes in the spine founded by the Hungarian and Croatian governments to enhance the European research area. Alongside physiotherapists, anthropologists, biologists, archaeologists, engineers were involved in the project. This research aimed to identify the daily life activities of past populations and compare them with contemporary populations. Additionally, the research provided a new perspective on the methodology of research work in all interdisciplinary fields from which the scientists involved in this research originated. The second research, founded by the European Commission, focused on working with Egyptian mummies and comparing the physical burdens of higher social classes according to age and gender, as well as comparing the impact of these classes on today's sedentary society. And the third research, also founded by the European Commission, covers the field of pain science from all aspects. Although initially focused on implementing results into future education programs, curriculums in Europe, it has raised question about future research possibilities in this area for clinical purposes and with other professionals such as psychologists and etc. As can we see in these three examples, physiotherapy was the focus, but also the main driver of implementing research results in everyday physiotherapeutic practice. And considering all the uncertainties and thus challenges in everyday physiotherapy practice without boundaries and prejudice, we can say that respecting the key characteristics of interdisciplinary research, such as integration of discipline, collaborative approach, solving complex problems, innovative solutions, and the last but not least, and the main important, transdisciplinary cooperation is crucial for advancing knowledge and skills in both, first, current and future direction of physiotherapy science and research. So thank you very much for your attention and for take-home message. Interdisciplinary research moves forward, physiotherapy forward, and also opposite.
To complete this panel of experts, now we have the presentation of Dr. Nathan Cardy. He is a founding member of the ISCP Research Network. He has been working in hospital, academia, and professional sports for the past 12 years, and currently his work is based in private practice. His presentation is titled The ISCP Experience of Developing a Research Network.
Good evening, everybody. Thank you for joining. I will be speaking to you this evening about the ISCP experience of establishing a research network. As we heard earlier on, about 50% of European member organizations have a research network or have staff who are actively involved in helping their members with research. And I'm going to speak to you about the experience of the ISCP in establishing our research network. The ISCP has 23 professional networks, so we're a very active organization. These include employment groups, clinical interest groups, some niche groups focusing on particular aspects of physiotherapy, and two really interesting professional networks that we have is the Research Network and the Innovation Academy. I'm going to speak today about the Research Network and how this offers benefits to our members. Members can join the Research Network free of charge during their annual membership when they renew their ISCP membership each year. So the ISCP Research Network was first established in 2017. So we have had a research network now for about 6 years. A steering group initially was formed by the Professional Development Standing Committee, which reports to the board of the ISCP. An invitation was extended to members of the ISCP to join an executive committee, and expressions of interest were accepted. And the Research Network Committee was formed initially with 3 senior academics, 2 postdoctoral researchers, 3 PhD students, and 2 full-time clinicians. So it was very important to us in the ISCP at the time to make sure that we represented physiotherapists, not just from academia, but also working in multiple areas as physiotherapists, as a big goal for the Research Network was to help to signpost resources for people who are not based in full-time research roles. So I was one of the PhD students at the time. Gráinne, who presented earlier, was also part of this. And obviously I've stayed involved since then. So a number of people working on the committee were also working as clinicians, which has been really useful for us throughout the Research Network. Initially, the aims of the Research Network and our terms of reference, our focus was to look at a number of things, but particularly networking and communication. So this means ways that we could facilitate our members to meet other members who are interested in research and how we could communicate with the membership about developments in research. This ties in with providing information and support to our members. So we did this through courses, through website, and I'll go through a couple of those examples in a moment. But also a big aim for the research network is around professional development. So not just individual development of members, but how the profession can develop by harnessing research and feedback from our members to the organization and to the board and to the various working groups, not just providing resources from the groups to our members. So an example of some of our annual activities, you can see here an image from our website. So one of the things that the research network will do on a regular basis is review and update the resources which we have regarding research. So our website is used as an area to signpost for commonly identified areas of interest of our members in research. For example, how to get started in research, how to apply for ethics, simple questions that people might have about where to meet other researchers and so on. We see the website as an opportunity to point people in the right direction. We obviously cannot answer every question, but this is something that we found very useful to also be somewhere in the future that we can hold videos of talks, things like today, where we can also develop resources that have been made available through the research network. Another thing that we do annually is try to facilitate networking and events. So both virtually and in person, trying to meet the aims that I mentioned when we established the research network. We want to make sure that the ISCP research network is supporting a culture of research within the physiotherapy profession in Ireland, and also supporting our members as scholarly practitioners. So obviously it's nice to be able to run in-person networking events, but one of the things that actually worked quite well for the ISCP in the last number of years was even facilitating networking events virtually, where we would have a presentation on a topic or from a speaker, and then we would use breakout rooms to put people with similar interests together to make it a little bit easier to network virtually, not just face-to-face. Another example of the type of activity which we carry out on an annual basis is identifying the research-related needs of our memberships. So the ICP will perform a learning needs analysis of our members every 2 years or thereabouts. So we will ask members of the organization what they feel is their areas that they need resources. For example, if we are to try to provide CPD courses, or we want to try and provide resources on the website. So we always include research-specific questions in this learning needs analysis questionnaire, and this will be fed back to the research network so that we can respond to the needs of the ISCP members. Again, this often results in us signposting resources on the website and reviewing whether new areas are becoming more commonly sought for information. For example, how do we use AI in research? That's something which we're hoping to update on our website soon. And also, if people are looking to facilitate more networking, or if people want more face-to-face or more virtual networking. Another thing that we can do in order to meet the needs of our members is assist with the scientific component of the conference. So having a professional network or a research network where we already have a group of people who are commonly interested in research means that when our organization is organizing its annual conference, a member of the research network will always sit on the conference organizing committee to help to guide the scientific component of the conference. Some of the benefits of this and some of the requirements of members who volunteer to be on the committee can be seen in this slide. So if you're a committee member, we meet roughly every 2 months, and this is usually online. We rarely meet face-to-face to facilitate people in their busy work days. We probably meet about 5 times a year. We target 6, and sometimes 5 is what we manage. And then through this, the committee members will establish smaller working groups for projects which might be identified. For example, if we identify that people are looking for new information in an area, a few people may set aside a working group to update the website, or people may contribute to organizing the conference, different projects each year. The other benefit or the other requirement, I guess, for committee members is to report back to the Professional Development Standing Committee. So this is one of the professional networks within the ISCP, and the research network reports back to the PDSC, who in turn will report to the board of the ISCP. And this means that there's a two-way relationship. After I initially was a research network member, I'm actually currently a PDSC member, but I still sit with the research network to facilitate communication in both directions. So it means that if the research network feels that there are areas of research which need to inform the society as a whole, we can feed this back. But equally, if the ISCP board has got questions or they have a requirement for input from a research specialty, they can use the research network to feed back to them on what they need. As a member, this means that you benefit from having the website maintained, that there are resources there for you, that there is regular training in research-related topics, and that you can input back on topics which affect the society in the future direction of research within the profession. There have been some challenges over the past 6 years, but this has provided us with opportunities, and we have sought solutions to some of these challenges. For example, like a lot of committees and a lot of organizations, the continuity of membership of the committee can sometimes mean that when the membership changes, it's difficult to continue a project. So one thing that has been quite helpful, and I know it's quite common, is that there will be an overlap in the committee terms. For example, a few members will step down after a 2-year period, but there will always be some continuing members so that you don't end up with a completely new committee. Something else which we did to try and maintain regular networking opportunities, which can be difficult, is that we regularly review an annual work plan. So we found it very helpful to set a standard for ourselves of having an annual work plan where we will perform a couple of things like virtual events, face-to-face events, website updates, and feeding back to other committees, so that we constantly have almost a checkbox of our activities, so that this is something which every year we have a few goals. We also find that keeping the website can require a lot of work, so our office staff within the ISCP have been fantastic to ensure we have support with this. Over the past few years, there have been some changes in our activities. We've been responsive to what has changed and the needs. So initially, our focus was on establishing awareness of the presence of the ISCP Research Network and setting up our website materials. As this continued through the first few years, we made sure to have a presence at the physical or virtual ISCP conference and ensure that we had regular events. As time went on, we review the learning needs analysis and we respond to that, updating the annual plan within the framework that we have of having certain things every year. This means that when we've established these more frequent resources for our members, we now have an opportunity to try to inform more policy and inform at a larger level decisions within the professional development of the ISCP. A few lessons which we've learned and some advantages of having this, some benefits which we might not have predicted, is having the resources of the research network can also help with disseminating some of the funding which we were able to distribute as the ISCP. So we have a research bursary, and members of the ISCP Research Network have been able to contribute to how this is awarded and how this is graded from our applicants. We also are able to provide support to the annual conference each year. We can provide our members of the committee, often are the people who end up doing the abstract reviewing for our conference. And it means that we have a point of contact for members who are looking to engage more actively in research. I mentioned that as we become more established, we can influence policy more. And something that the Research Network is now doing is working to help support the research pillar as part of our recently developed career framework, which the ISCP also has. So thank you very much for your time, and I'll be happy to answer any questions shortly.
Okay, I would like to ask Nathan. Nathan, thank you very much for your presentation, and really it's very interesting for all of us to have somebody with experience in research network. I would like to ask if you saw, of course, you have only 6 years running this network, but have you any data, or have you noticed any change in research activity, or how many people are involved in research activities in Ireland after the establishment of the network?
That's a very interesting question, and definitely a question from a researcher. We didn't gather data specifically on research output and the influence of the research network, but what I can tell you is that we've seen the membership of the research network grow from the first year until now. So I guess you can assume that those resources are being disseminated to more people and that that's influencing research. We already do have 5 universities in Ireland which are very active in physiotherapy research. So while it's fantastic to have a research network for our members, a lot of what we're doing is signposting to resources rather than actually carrying out research ourselves. So I remember one of our presentations where they looked at the influence. I think it was Gráinne who talked about the guidelines that were developed and so on, and the impact of research. It's not something which we're currently tracking, but I think it would be interesting to do that. And I think that one thing we have seen is linking more members with the universities, which probably leads to more impact from the universities.
Okay, thank you. Can I ask one more, Carmen?
Yes, you can.
Thank you again to Nathan. Nathan, is the association involved in any research activity?
Directly, so is the ISCP carrying out research itself?
Yeah.
Not directly. So the research network is a way that we facilitate members to carry out research. It's a way to signpost people to link with the university or to link with other members. We do also provide a research bursary, which allows people to apply for funding, but they would need to use that funding to seek ethics through a university, for example. So we don't offer an ethics committee within the ISCP. So that means if you're doing research, you still need to link with an academic institution or a higher education institution.
Thank you very much. Thank you.
Thank you.
I have 2 questions for Raf. And as you introduced this example of Dynamit versus doing a search through PubMed, the first question would be, you mentioned as one of the barriers for clinicians of accessing evidence is cost. So you didn't address this point. So the Dynamit tool, the costs that are involved for any subscription fees. And then the second part of the question would be, what are your thoughts on using AI, for example, as an additional tool to identify valuable, reliable research?
The use of AI for? I didn't hear the last thing of your question, Brigitte.
And use AI also to identify reliable evidence for clinicians.
Yeah. Okay. The cost. I know that the cost for Dynamit for 1 year is €100. But in Belgium, the member organization has a complete package of the CBEM Digital Library for Health, where there are a couple of physiotherapy journals in it. There is also Dynamit in it. There's also evidence-based practice in it. And they offer it with the fee of the membership. So there it's everything included. I don't know how much it costs for the member organization, but if you would like to use it as an individual, I know the fee you have to pay in Belgium to use it for 1 year is €100. To give you an idea, which is, it's €100, but it's not a huge amount of money if you see what a journal already costs. If you would like to use it, I think it's really acceptable. The use of IA, I'm not completely familiar with it. I know that we did some tests at the university, and it's a language model, and a language model will use patterns which it finds. And if you use a language model, yeah, it has also some risks because it doesn't use one source, and you can easily try it if you ask in a language model like ChatGPT, for example. If you ask some evidence with the references, and you will check the references, you will see that it will be nonsense, because they just pick up the patterns. And I think it is at this point, because it's not, the language model isn't developed for it. So using ChatGPT would not be a good idea at this level. But AI is much broader than of course the language models. And if you look at AI, at specific things which they developed for research, I think there are some opportunities. I think the most known example is, for example, AI is specialized in one way in recognizing patterns. And for example, with medical imaging, AI can really add some value to it. But to use it as, let's say, as at a consumer level at this moment, I'm not enough familiar with it to say we should definitely do it at this moment. So for specific issues, it can be very interesting, but it would be not a good idea to use, for example, language models to go for the evidence.
We have another question for Michele. It's from Felix Kahn. The question is that she would like to ask a question to you. Did you also ask some question to the medical doctors about the value of exercise for cancer patients?
Yeah, we didn't get directly to the doctor. Well, we worked with general practitioner to spread the information about the project, and to also, doing some marketing among citizens. But the ACMS criteria go through medical clearance by the end of the flowchart if it is needed. And I can tell that, for example, data from Bologna, among more than 70 citizens recruited, the 50% needed a medical clearance, and the medical clearance was given by the medical doctors. So what I can tell is that medical doctors cleared citizens to do physical activity with us. So I don't know if I'm answering your question, but this is the only data related to medical doctors that I have at the moment.
Raf, is there any other application or program like Dynamed, similar to Dynamed?
Up to date is there are many, but the two where I'm familiar with are Dynamed and Up to Date. And Up to Date is often used in hospital settings.
We have one answer that Up to Date yearly subscription is $449. I think they wrote. I would like to ask Snježana, because we speak about interdisciplinary research, and we also speak of course, about interdisciplinary approach. But what do you think are the main barriers for carrying out interprofessional or interdisciplinary research?
Oh, that's a pretty hard question. Everything is not so easy regarding the interdisciplinary research if you are a physiotherapist. So there are lots of barriers, but I think that The first barriers are coming from ourselves. If we are thinking about the research only in biomedicine field, and that is the main reason for the huge barrier. The money usually is not, because you can enroll in many European Commission tenders and you can choose whatever you want. But for the first thing, I think that there are lots of strange ideas, and sometimes it seems that maybe it is not appropriate to do something for the research. If you are a physiotherapist, you need to be strictly on the physiotherapy field way, and that is maybe the main barriers. Maybe just to think about out of boxes, and everything could be possible somehow. And that is a huge challenge, I believe, for all of us.
And it
So
would be
that
really
not only if we
beneficial.
are, if we are coming from the universities or from the clinical fields, that's different, of course. But when we are thinking about the future on that way, I always think what I can offer to my students, for example, when I teach them which kind of ideas I can offer them to think about, not only from the physiotherapy side. That is the reason why I thought that maybe this kind of connection between from which side we are focused on our ideas, it seems that it could be the solution for some kind for the key to do something better for all of us, especially for our patients.
Yeah.
On that way, to be free on thinking, just to have one simple question, and that's all.
Yeah.
Sometimes it's not simple, but at the end, you know what I mean.
Yeah.
I have a quick question. Gráinne, you mentioned the CSP research priorities, and World Physiotherapy also is about to start a project on understanding what the member organizations' research priorities are and whether there are any lists existing. So my question for Nathan, is this has got the ISCP, do they have a list of research priorities, or how do you identify gaps in research for your community?
Thank you for that question. The CSP report is not something that we have done in Ireland. We don't have the similar report from the ISCP. So I think this is probably something that is done in the universities, again, more than the ISCP Research Network. So something we've been careful with in the research network is we're very lucky to already have a lot of very established research departments within the universities in Ireland. So our goal is to link these resources, not just the universities, but globally research resources for our members. We haven't produced a report. It would be interesting to look at it to see if there's differences between the UK and Ireland. And actually, I was interested when I saw Gráinne present on it today to see if we would do something similar, but so far, no.
I would like to close and to finish this webinar. But before, I would like to again thank to the panelists, to the experts for their contribution and the dedication to this webinar. And I hope that it's been of interest to you. And of course, thank you, all of you, for joining us and for your contribution to this webinar. I hope to see you soon.